State Budget Director Robert Mujica said a decline in expected tax revenue, rising costs of healthcare and a challenging environment in Washington, D.C. led the state last week to eliminate a proposed $550 million boost to Medicaid for fiscal 2020, which starts April 1. Because of the federal matching funds that support Medicaid, the healthcare industry is projecting the total impact to be $1 billion less than they expected after Cuomo's proposal last month. Last month, Governor Andrew Cuomo had said local hospitals were under attack from the federal government and needed support. He was referring to the planned $1.4 billion cut to the Medicaid disproportionate share hospital funding, which will take effect October 1. But as the Cuomo administration created its revised financial plan, it found tax collections for the current fiscal year and projections for fiscal 2020 to be a combined $3.8 billion less than expected. Projections for next year were lowered $1.2 billion, including $900 million in personal income tax revenue. The state needed to find areas to lower spending, and targeted health care, one of the top spending categories, even though it had announced spending increases in the governor's initial budget proposal. The revenue picture changed, Mujica told Crain's. Cuomo blamed the federal government's changes on the deductibility of state and local taxes for the state's budget gap, saying that the higher tax burden has caused some of the state's wealthy residents to relocate, or at least change their residence for tax purposes. The governor released a three-pronged plan to achieve the savings. The state is diverting funds it had earmarked for healthcare transformation toward housing programs, reducing indigent care funding, which supports hospitals that provide a large percentage of services to Medicaid and uninsured patients, and levying a 0.8% across-the-board cut to Medicaid payments. We would rather not do these cuts in 30-day amendments, but that's where we find ourselves with the revenue, Mujica said. If something changes we could revisit this, but we don't see that changing right now. The decision drew swift condemnation from the Greater New York Hospital Association and the state's largest health worker union, 1199 SCIU, two of Cuomo's closest political allies. As we seek to balance this budget, it cannot be done on the backs of our most vulnerable communities, and the dedicated workers who provide exceptional care, said George Gresham, president of 1199 SCIU. Many hospitals would curtail vital services, and some would close their doors for good, NYHA President Kenneth Rask said in a statement.